Welcome everyone. This is Alveoly E-learning. My name is MK Obin. I'm one of your course instructors at Alveoly E-learning. The main purpose of Alveoly E-learning is to make learning simple and easier for all students, irrespective of where you are. All you have to do is to get access to a mobile phone, a computer or a laptop with an internet. Then you just sign up to www.alveoly.com. Okay, then you just get your pen and paper. When you log in, you have access to various courses. Then with the course that you have your interest in or you have difficulties in, then you sign up to those courses. Hello everyone. You are once again welcome to Alveoly E-learning. From our previous lesson, okay, we looked at forms through which edema can be formed. And we looked at about 4 steps or 4 processes through which edema formation can occur. So if you haven't watched it, kindly watch that video to help you to understand the formation of what edema. Today we are going to look at how edema manifests itself. Okay, so edema is a sign that indicates what there is a swelling somewhere in some part of our body. However, we can group how it presents itself into 2 parts. So we have 1, localized edema. And generalized edema. So let's look at the first one, which is localized edema. When we say local, it means that something which is occurring at one place or one portion or one part of our body. So for instance, the word local anesthesia means that we are going to make just a small portion of our body to become anesthetized. So localized edema implies that edema occurring at only one portion or one part of our body. An example of localized edema includes periorbital edema. The word peri means around. Okay, so peri means what? Around. Okay. Orbit means the socket of the eye. Hence, combining these 2 words, periorbital edema implies that edema that occurs around the socket of the eye. So you see that this form of edema is only occurring around where? Around the socket of the eye. Okay. Hence the word periorbital edema. Let's look at another form of localized edema. We are saying that localized edema basically means edema occurring at one portion or one part of the body. Okay. So 2. We have ascites. Ascites is the formation of edema in the abdomen or the peritoneum. The peritoneum is a layer that covers the abdominal organs. When there is a swelling at that particular area or there is a fluid accumulation within the peritoneum, then we term it as ascites. So you see, ascites is also occurring at just one portion or one part of the body. Then we have pulmonary edema. So the word pulmonary means lungs. Anything in association with the lung system as pulmonary edema. So this implies that when there is edema accumulation or there is fluid accumulation or edema occurring in the lungs, then we termed it as what? Pulmonary edema. And this usually occurs in cases when there is what? Left-sided heart failure. So mostly the signs of pulmonary edema includes like difficulty in breathing or shortness of breath. There is cough, there is tightness of the chest. There can also be what? Wheezing sound production. And they all mostly occurs when there is what? Left-sided heart failure. So in an objective question, when they give you a question like which of the following occurs in left-sided heart failure, you should be looking for what? Pulmonary edema or signs of what? Pulmonary edema. Okay. Later on, when we look at heart failure as a condition on its own, I will explain further into that. Then we also have pedal edema, which is edema which occurs at the lower extremities or the pedal portion of the lower extremities. So basically, you realize that all these forms of edema are occurring at just one portion or one part of the body. Hence the name what? Localized edema. Then let's look at the second form of what? Edema presentation or manifestation. So the second part of edema formation or manifestation is what? Generalized edema. In generalized edema, what usually occurs is that there is edema of what? The whole body. So that's why we call it what? Generalized edema, which is commonly known as what? Or commonly called what? Anasaka. So anasaka is just a term for the occurrence of what? Generalized edema or edema of what? The whole body. So basically, these are the forms through which edema can manifest itself. So we said we have what? Localized edema and generalized edema. Localized edema occurs when there is edema formation of one part of what? The body. Whilst generalized edema is what? Edema formation of all what? Or the whole body. Then we term it as what? Anasaka. Now, let's go back to the generalized edema and focus more on ascites, which is one question that they usually ask in exams, in most nursing exams. So I would like us to have some basic things or know some basic things about ascites. Okay. So we said ascites is when there's excessive fluid accumulation in the abdomen, to be specific, in the peritoneum. And we are saying the peritoneum is a sac that houses all the abdominal organs. However, when there is what? Excessive fluid accumulation or excessive fluid formed in the peritoneum, then it leads to the formation of what? Ascites. And this is mostly seen in patients with what? Liver conditions. We can also see them in sometimes patients with what? Heart failure and other conditions as well. So let me use this. So let's consider this part to be what? The thoracic cavity. And we said the thoracic cavity is just a space where the lungs and its associated organs, example the heart, are located. And this is what? The diaphragm. The diaphragm is a thin layer of muscle that separates the thoracic cavity from the abdominal cavity.